Well, the thing, Dean McKenzie, that drives me is my commitment to this whole concept that the Johns Hopkins School of Public Health stands for, namely public health not only of our nation, but of the world. I'm fundamentally a physician, but I'm also a scientist, and that when I got involved as the director of the Institute, I had been an AIDS researcher for a few years before then, fundamentally a chief of a laboratory at the NIH doing clinical and basic research in HIV. When I became the director of the National Institute of Allergy and Infectious Diseases, I was exposed to the broad aspects of global health that were intertwined with HIV. And it became so clear to me that there were so many problems throughout the world that could be addressed both by science application, and good public health measures. And I really became totally committed to that. So when you say what drives me, what is the driving force, it's the realization not only of the enormity of the problem, but of the fact that we can do something about it. It is not an unsolvable series of problems. It is something that we can do something about. And the second part of your question, you mentioned about the role of government in that. Well, government at its best can be responsible for things that individual private sector components would not be willing to take up. So, for example, in the United States, and it's not just confined to the United States, we have the realization that there are the need to develop interventions in the form of vaccines and therapeutics for diseases that may not be the kind of commercially viable interventions, but the world needs them. We've seen that with many of the things we've done with malaria, with tuberculosis, diseases that are not particularly germane to the people of a given country. But because it's a global health problem, if you look at what we've done through the NIH, through the CDC, through other agencies of the federal government, it has really been critical to the viability of a good public and global health effort. So it's something that, I mean, as I know you do, Dean McKenzie, it's something that I love, as something that is a task that I wake up every morning feeling that there's a chore ahead and there's something we can do about it. The stakes are enormous. You're talking about people's lives and people's health. I don't want to put down any other profession, but it just seems to me that you can't get much better than that if that's what you're suited for and that's what you want to do.
Absolutely. And we're so happy that you have that drive and that commitment to that mission. So you mentioned your early years in fighting HIV and AIDS. And can you reflect a little on how the experience in those early years has informed your response to the current pandemic?
There are some similarities and some stark differences. Back then, it was perceived as a very restricted problem. I remember I wrote an article in 1981 that got published in 1982 saying that anyone who thinks that this disease is going to stay restricted to an epidemiologically restricted group doesn't know much about infectious diseases, because the chances are that it's going to be a global issue. And as it turned out, unfortunately, very unfortunately, that was prophetic. But we had difficulty getting people mobilized to realize the potential impact of this, because it did not universally affect people in a uniform way. It was a behaviorally related disease, whether the behavior was just something that people could not avoid or was part of a culture or what have you. It was behaviorally related. Whereas what we're dealing with now is a very, very complicated issue, I must say, Dean McKenzie. It's complicated because it is having a global, serious impact, but there is very difficult in relating to the people how serious it really is, because there are so many people who get infected who have no serious consequences.
Right.
So how do you mobilize a uniform message, an effort, that this is something that's serious, that we need to take seriously, and all you need to do is look at the numbers. 215,000 deaths in the United States, 7.8 million infections, over 1 million deaths worldwide, and yet, understandably, there are people who look at the disease and say, if I'm a young, healthy person, the chances are nothing is going to bother me, so they don't want to participate in the control of an outbreak that for some people, the vulnerable people, the elderly, those with underlying conditions, disproportionately hitting minorities, for those people, this is a very serious threat. So I just find that in both cases we had messaging difficulty, messaging of getting people to understand what HIV/AIDS was and what it ultimately would turn out to be. And I find that we're having the same messaging difficulty right now.
Mm-hmm.
Those are the similarities and those are the differences.
And do you think we'll ever learn, the general public will ever learn that public health message? That it's not just taking care of yourself, but it's taking care of a community?
I hope so, because that's at the essence of global health.
Yeah.
If you're interested only in individual health, you're putting yourself in somewhat of a vacuum, which means if it affects me, bothers me, I'll worry about it. If it doesn't, who cares? Well, that's the antithesis of someone who is aware of and connected to the concept of public and global health. And it's what I say when we talk about COVID-19, the same theme that I mentioned a moment ago, that if a person gets infected and says to themselves, the chances are that I'm not going to have a deleterious consequence. So it doesn't matter to me. So I'll do whatever I want to do. I'll practice risk behavior. I'll go to bars, be crowded, not wear a mask. Well, that would be fine if your infection doesn't ultimately impact other people.
Sure.
But you've got to get the message to people that if you get infected, even if you don't have a single symptom, what you are doing is you are propagating a pandemic, because by getting infected, you're keeping the pandemic alive, so that even without symptoms, you may inadvertently, and I'll even use the word innocently, infect someone else, who will infect someone else, who then you might have someone who's really vulnerable, someone's grandparent, the wife of someone, a woman who has breast cancer is on chemotherapy, someone's beloved wife, a child with an immunodeficiency, an African-American young person with sickle cell disease. Those are the people that are going to be at very high risk for serious consequences. So if you think that by getting infected and saying, poo-pooing the prevention modalities, that you're living in a vacuum and you're not, no, you're becoming part of the problem when you should really try to be part of the solution.
Mm-hmm. I think we could spend the entire time we have together talking about how to get that message out, because at the root of things, it's so critically important. I'm hopeful that this pandemic will change the discourse, but we'll see. But moving on, let me ask you now, so you've been at NIAID for many, many years, and you've been through many challenging moments as its leader. What advice would you give to aspiring health policymakers about the relationship between science and politics?
Okay, so I would get them to understand that there's a difference between politics and policy.
Uh-huh.
And that means that science and evidence-based facts that you bring out, going with the data, going with the science, and being flexible enough when you're dealing with an evolving situation, which we are in the middle of right now. We still do not know everything we need to know from a public health, from a clinical, or from a scientific standpoint about COVID-19. Mm-hmm. So when you're talking about policy, making policies, what should we be doing in public health measures? how do we prevent the spread of infection? What do we do about school opening or not? What do we do about business opening or not? That is policy that's based on scientific facts. Politics are a different thing, because when you're dealing with politics, then you have people who understandably, because politics are good, I mean, politics is how countries are run, that people have agendas. And the agendas may not necessarily coincide with what you, as a public health person, sees as using the facts and the evidence to guide you in your policy. So my advice to young people is, unless you want to be a politician, stay away from the politics and let science and good data and good evidence guide your policy.
And you've done an excellent job at that, and I know it's not easy all the time. So as someone who has a strong connection to academic medicine and biomedical research, what do you see is the role of universities in the policy making process, and how has this role evolved over time, and what would you like to see universities do? What role would you like to see them play as the current pandemic continues to evolve?
You know, the universities, including, you know, very much your own, is really the home of such extraordinary academic talent of people who come in with an inquisitiveness to learn, to get down to the facts, that it is, to me, an indispensable part of any effort in science or in global health. The government itself, the NIH, for example, of which I'm a member of one of the institutes, has been historically a great supporter of what goes on at universities and schools of public health. Mm-hmm. I think you need to synergize and partner with each other. I don't think the federal government could do this by themselves. I don't think the academic community would have the support to be able to do it by themselves. And then we want to bring in another component, which is as important as the other, is the pharmaceutical companies. Where you have a partnership between the pure academics of the university with the mandates that a government has, particularly for public health and the health of the nation and the world, and to develop interventions that are going to get us to that goal, which is bringing in the pharmaceutical companies. So I think the academic institutions, the universities, the medical centers, the schools of public health, the schools of medicine, are extremely important to any effort that we're going to make in public health for our own nation as well as globally.
But we need to partner more.
Oh, absolutely. I mean, you can't silo at all.
Mm-hmm. Right. So here's a question that our faculty are particularly interested in asking you. So some of our, especially our early career faculty, are quite worried about the cascading effects of the pandemic related research delays, including reluctance of patients to enroll in studies and cohort studies, as well as a whole slew of other issues. And while we're very grateful that the NIH allowed investigators to draw on their grants during the pause, we still need to backfill those funds. And I guess the question is, how concerned are you about the impact of the pandemic on NIH, both intramural but also extramural research, and especially in relation to the advancement of young investigators? We worry about our young investigators more than ever during the pandemic.
Oh, you bring up such an important point, Dave McKenzie, that is very troublesome to us because, as you know, even prior to COVID-19, we were concerned about the lack of consistency of funding for the NIH, and young investigators who rely on funding from institutions like the NIH have an insecurity of not knowing what's going to happen 2-3 years from now, particularly when they see their mentors being insecure about getting grants. Then you superimpose it. We've been fortunate enough that the Congress, over the last several years, not counting this past year because it's been money put in for special projects to COVID-19, they've been pretty generous with us. I mean, the Congress has been been extraordinary in their generosity to the NIH, led by some real heroes on both sides of the aisle, in the Senate and in the House. But now when you have this interruption in the hiatus, the only thing I could say is to encourage the young people to please hang in there and don't give up on what could be a potentially enriching career. At the NIH, we are trying very hard, and I think we'll be successful, to get resources to go and backfill on the essentially lost time, lost experiments. I can tell you my own self in my own laboratory at NIH, where you have cohorts that you're following, that you can't bring them into the hospital to follow them.
Yeah.
And we have clinical trials that are 2-year clinical trials that all of a sudden have to stop and pause. And I do my very best to encourage the postdocs, the young tenured faculty, to just hang in there. It's going to get better, I promise you. Just please hang in there. Don't give up. Don't give up. The cavalry will come, I assure you.
Well, that is a great message, and I hope all our faculty, especially our young faculty, are listening to this and hearing that message. So it's great advice. And so we reached out to our students and asked them if they had any questions for you, and we got a few. And one question that was submitted by a student at Bloomberg School of Public Health relates back to what you were just talking about, and the difficulty in enrolling patients into trials and to cohort studies, and how that might be getting a little bit more difficult. And the question from the student is, what advice do you have for students who are concerned about the erosion of the general public's trust in science, to try to gain that trust back in the future line of work? Because that's something, as investigators and scientists, we're quite concerned about.
Yes, and I think that's being strained and stressed right now, what we're going through with COVID-19, and we're already seeing expression of reluctance in not trusting the scientific establishment to free themselves of political influence about whether a vaccine is safe or effective. So what we in the scientific community, the young people, the people at intermediate levels, and people at my level, which has been at for decades, is to continue to abide very strictly by the tenets of science, the honesty, the transparency, the flexibility, the humility of knowing that we don't know everything at any given time. And I think when the general public sees that in the scientific community, that we admit that we don't know everything and that science is evolving. And one of the things that I think we need to do a better job at is to get across the concept that science is really, in so many respects, self-correcting. And by self-correcting, we mean that as things evolve, you do an experiment or you gain scientific knowledge, and it might be absolutely true for what the situation is at that given time. But as more data and more knowledge evolves in a situation, you might have to say, we thought it was this way back then, but we've got to be humble enough and honest enough to know that scientific data now says it's a little bit different than we thought. So it's just pure honesty and transparency that I think is going to get us out of any skepticism about our motivations and about the scientific community.
Sure. And you think that's going to translate into the public's acceptance of vaccines once we have effective vaccines?
Yeah, I hope that
trust.
Yeah. But we've got to do it correctly, because we've got to make sure we stick by and insist on the scientific standards that we put forth before we make a decision about whether something is safe and effective. We can't compromise. The public is trusting us, and if we really want to get into a problem of dissolution of trust, it would be to veer from sticking strictly to the scientific data and the scientific information.
So let's take a little bit deeper dive into the current pandemic. The U.S. is now seeing over, by last count, around 50,000 new cases of COVID-19 a day. That's compared to Ohio around 70,000 over the summer. What do the current trends tell us about the country's response, and what is ahead for us in the next 6 months?
Yes, I'm concerned about that, Dean McKenzie, because we have a baseline now. You know, the baseline fluctuated. It never went down to the level that I would have hoped it went down to. When we had the big peak in the early spring, which was driven predominantly by the Northeast, and the majority, in some respects, of the infections and the hospitalizations were driven by New York and the New York metropolitan area. When it came back down in New York, other states and regions of the country went up. The baseline never got down to a few thousand, less than 10,000 per day. It kind of got stuck at 20,000. Then when we tried to open up the economy, particularly in some of the southern states, like Florida, Georgia, Texas, Southern California, Arizona, it wasn't done uniformly, and we started to see a surge that came up to about 70,000 a day. Now it's starting to come down, but it's stuck around 40 to 50,000. You can't enter into the cool months of the fall and the cold months of the winter with a high community infection baseline and looking at the map and seeing the heat map, how it lights up with test positivity that is in more than 30 plus states is going in the wrong direction. Because right now, at least where you and I live, we're going to start doing a lot of things more indoors rather than outdoors. And that's when you have to be particularly careful about the spread of a respiratory-borne disease. So it's still not too late to vigorously apply good public health measures. And again, I emphasize, without necessarily shutting down the country. Because whenever we public health officials talk about implementing public health measures, people think that we want to shut the country down. We don't want to do that. We want to use public health measures in a prudent, careful way to help us to reopen the country, to reopen the economy, to get jobs back. So public health measures, as I've said so many times, needs to be the vehicle and the gateway to opening the economy, not the obstacle to opening the economy.
Mm-hmm. So for those of us, for some of those folks in the audience, could you just go through what those public health measures are? Because it's such an important message.
Yeah, I mean, there are really about 5 of them. They sound really quite simple, but they're important because we know they work. One is uniform wearing of masks or face coverings. Number 2 is, to the extent possible, keeping distance. Number 3 is likely the most important. Avoid crowded places, congregate situations in which you have a lot of people predominantly indoors, crowded together without wearing masks. 4th, do things to the extent that you can, outdoors preferentially more than indoors. And if it's indoors, good ventilation. And finally, washing your hands as often as you can. All of those are directed to mitigating against a respiratory-borne acquisition or transmission of infection. You can do that while you're still marching carefully to opening up the country. It doesn't mean that you have to revert back to closing the country.
Mm-hmm. Such an important message. Although I suspect many Thanksgivings are going to look a little bit different this year.
I think they will, Dean McKenzie. I think people are going to have to make a choice of where they fit in the risk-benefit ratio of having someone come in maybe from out of town who's been through a crowded airport to come into a home. Who do you have in the home? Are there vulnerable people? Are there the elderly? Are there people with underlying conditions? I think each family needs to think seriously about that and make a decision based on the level of risk that they want to put themselves through.
Yep. So my next question really builds off of the answer to your last question, and that is, if you look at our country, there seems to be a cycle where we have a surge in cases in a particular region of the country, the surge decreases or plateaus, preventive measures are relaxed, and over time the numbers then escalate. How can we break this cycle and move away from this reactive approach to public health and move towards a proactive approach?
Yeah, well, I think what you're referring to is sort of like a whack-a-mole situation. This
Yeah.
one down, this one
Yeah.
up. I think what it's begging for is a consistent, uniform approach of all of this country pulling together to extinguish this high level of community spread. When you have some elements in some sections, states, cities, counties, or what have you, doing it one way, and then it sort of, in many respects, endangers other areas. You kind of think about the country as a gigantic forest, and when there's fires in one part of the forest, the other part of the forest is vulnerable. So if you want to get control of things, we've got to be consistent. We've got to do things with the ultimate purpose of getting control over the outbreak. And unfortunately, we haven't done that as well as I think we could.
Yeah. And a related question, and I know these are not easy questions, but this is one coming from a student at the Kruger School of Arts and Sciences. And the student writes, my hometown is full of people who are not taking the pandemic seriously, holding large social gatherings and refusing to wear masks. How can we get the word across that this is a serious issue?
Yeah, you're sighing as you're asking that question, Dean McKenzie. And I think your sigh is justified because it's very frustrating. Unless people can actually see the devastation and realizes that it affects them, we see so many examples of people who really take risks because they have a way of dissociating themselves from this problem that's looking at us square in the eye. I mean, this is a historic pandemic. 215 plus thousand people have died already, and we're closing in on 8 million people have gotten infected. That is serious business. We need to keep trying in a non-pejorative way, in a non-confrontative way, to get people to understand what their societal responsibility is.
Once the vaccine or vaccines are available and widely distributed, do you think we'll eventually return to normal? Are there aspects of this pandemic that will likely permanently change how we go about doing things? Or will there be a new normal?
I think that we will ultimately get back close to what was formerly normal without even considering any of the things that we consider right now. I think how quickly we get there and how completely we get there is going to depend on a number of factors that we can't nail down now. First, the efficacy of a vaccine. Is it 60%, 70%, 90% effective? As important is what is the uptake of the vaccine? Will people willingly get vaccinated? Will they accept the fact that even after we get a vaccine, we likely would have to implement to some extent continued public health practices? We may not, for months and months and months into 2021 or even beyond, we may not be able to, in every section of the country, have uninhibited theaters that are just completely packed, sports events where the spectators are crowded all over each other. We may not get there for a while, depending upon the factors that I mentioned. Vaccine, uptake, and our ability to implement some form of public health measures.
Just a couple of other questions. So here's one from a student from the School of Medicine. And the student writes, this pandemic, and you addressed this to some extent earlier in your comments, but the pandemic is a global phenomenon, as you pointed out, and will continue to be a threat until it is vanquished from all corners of the globe. Assuming the U.S. will eventually control things at home, What can we do to ensure global health security?
Yeah, there are a lot of attempts to do that, and one of them is the Global Health Security Network, to have a network throughout the world of transparent interaction among countries that would recognize early on anything that even resembles the beginning of an outbreak, to share reagents, to share specimens, to be transparent, and to help each other out. Because just as I said, it's important for the United States to pull together, because we're all in it together. When it comes to global pandemics, every country on the globe is in it together.
For sure. So our last question, I would love to get your thoughts on some of the broad lessons that we might, the good lessons that we might learn and take away from this moment in history. For instance, the public has shown an unprecedented interest in data and scientific evidence during this pandemic. We see it reflected every day in the traffic to the Johns Hopkins Coronavirus Resource Center and our own publishing channels here at the Bloomberg School. What do you think why do you think we're seeing this interest, and what can we do to sustain it in the months and years to come?
Yeah, I think it's a realization on the part of more people about what counts is facts and truth and data. And I think as people get more experience in these arenas, they realize that we are a data-driven discipline. We are. I mean, some other disciplines are driven by artistic creativity. I like that. That's wonderful, but that's not what we do. What we do is data-driven things, be they experimentation to understand disease, experimentation to understand global health issues, the development of countermeasures, vaccines, diagnostic therapeutics. That's who we are. That's what we do. And I think when you realize who you are and the instruments that you have at your disposal, data and facts are our tools. So that's the reason why it's happening, thank goodness.
Yep. And I think we need to leverage this opportunity so that we do better in the future. Well, thank you so much, Dr. Fauci, for taking the time. I know you're a very, very busy person these days, and we really appreciate your being with us, and I personally enjoyed talking with you. And once again, we're so fortunate to have your leadership and your insights into this historic time for all of us. And thanks to my co-host, President Ron Daniels, in absentia. And again, he sends his regrets. But also thanks to all of you who joined us today. This series will be a quarterly event, so this is the kickoff event, and it's an event hosted jointly by the Schools of Public Health, Nursing, and the Carey Business School at Johns Hopkins Medicine. And I hope you'll join my colleague, Dr. Paul Rothman, Dean of the Johns Hopkins School of Medicine, for our next session in the next few months. And please check back on the Johns Hopkins Coronavirus Resource Center for more information on these symposia and other great information. Thanks again, and please, again, to our speaker, Dr. Fauci, and to everybody here in the audience, stay safe, be well, and have a great afternoon. Thank you.
Thank you very much, Dean McKenzie. I appreciate you having me on the program. Thank you.
Absolutely.